My name is Brian Blase. I am the president of Paragon Health Institute, and we have a really great first initial product that Paragon is producing, a state health reform book titled Don't Wait for Washington: How States Can Reform Healthcare Today. It's an important book for policymakers looking to expand access, lower costs, and improve care so patients can get the right care at the right time at a price they can afford. Today, Grace Marie Turner, the founder and president of the Galen Institute, where I have done a lot of my policy work for the past 2+ years, is with me. Welcome, and thank you for participating in this.
Brian, I could not be more pleased to help you launch this first product. It is an incredibly impressive book. So tell me a little bit about why this is your first product, why you decided to start here.
Yeah, Grace Marie, it's because there's an opportunity right now at the state level. In Washington, really much of the focus is on expanding government control right now, and they're not as receptive to many of the ideas to empower consumers and increase competition in healthcare markets. But at the state level, that opportunity exists. And we want to focus where we can have some policy wins and really provide examples for what the federal government can do. I mean, we saw that with welfare reform in the 1990s, with Wisconsin leading the way on reforming welfare and incentivizing people to work rather than be on government assistance programs. And if we can start at the state level and show federal policymakers examples of policies that really do work to help patients and families get better health care.
There has been a lot of work in Washington to try to devolve power away from Washington to the states. The Healthcare Choices Plan that actually incorporates many of the recommendations that you made through your work at the White House with choice and competition, and also the regulations that were created during your tenure there to really give consumers more choices, to give employers more choices. Do you think that states are ready for this? Do they want to take the reins and move forward?
Yeah, we've seen states make positive actions as response to the coronavirus pandemic, Grace Marie. Many states loosening up laws allowing expanded telehealth, allowing providers greater ability to treat patients. Arizona passed really a landmark telehealth bill this year. And the state of Texas allowed Farm Bureau plans to sell health benefits coverage. We, in the book, discuss reforms that some states have made to their state employee health plans. States realize that health care is in part under their jurisdiction. It is the most important issue that voters routinely say they care about. And there's a lot that states can do, irrespective of the policymaking that's going on in Washington. Obviously, we'd like to have supportive policymaking in Washington as well.
I just think that the table of contents is so impressive. How to manage effectively, maximize choice, welcome competition, unshackle providers, unleash technology, empower patients, implement transparency, and of course demonstrate leadership. It is really it's a broad range of experts, and it's a broad range of topics that I think are going to be very, very relevant to the states. So if you could give us just a little bit of a taste of what's coming.
Really, I mean, you hit on the main policy focuses. It really is in three buckets. So there are things that the states can do to better manage programs that are under their control. And here we take on state employee health plan and the Medicaid program. And the Medicaid chapter is particularly important given what we know about improper enrollment in the program, that because of legislation that Congress passed, states have had to keep people who are ineligible for the program on the rolls. And it's going to be important for states to get a proper handle on that. There's also a series of chapters on freeing doctors, nurses, and hospitals to best treat patients, to remove sort of anti-competitive policies like certificate of need laws, which have been extensively studied and have been shown to harm patient access and increase costs. And then, really, the third set of policies is what we can do to increase the control that families have over their own health care. So, to maximize their coverage options, to give them power to shop for their prescriptions, and to have the data that they need to know the quality of their healthcare providers.
Brian, obviously, this book is primarily intended for state legislators, but give me a little sense of who your target audiences are and who you believe need to know about this. Certainly, the Washington policy community does because we are so supportive of state action.
Yeah, that's exactly right, Grace Marie. We want to change policy at the state level. So state legislators, their staff, folks in governor's offices and state executive branch agencies. And really what we wanted to do is give them the research. So a lot of, there's a lot of citations and evidence presented in the chapters so that the policymakers can really rely on these policy recommendations. They are very much grounded in evidence and data.
And it's clearly a menu of options. And I'm sure that you and your co authors at Paragon are ready to help them with specific implementation ideas.
Absolutely. We are going to serve as resources, talking to legislators, providing testimony when needed, and really doing everything that we can to educate state policymakers on sort of these important areas of health policy reform.
Well, congratulations on this book that you've edited and that you have such excellent contributors to offer their ideas and their expertise. And look forward to talking with you further, Brian.
Thank you.